Well, we are back here. Irina, I don't know if you're watching yet, but you're going to be watching right now because we have this new guy here named Denny, and he's going to tell us a little more about you. And what did you have? What was she in there for? And what was the situation?
She had sciatic so bad that every morning she'd get up and...
What is sciatic? What is that?
It's a nerve that goes down your...
In the back.
Down your leg, And when you have that, you can't even get up and walk. I mean, she'd get up in the mornings and literally for a half hour, she'd be in real bad pain. And then eventually it would kind of let go. And then she started to have pain across her back. And I said, well, we've got to go see Dr. Dan. And I looked it up, of course, on the internet because I'm so incredibly intelligent. I diagnosed it myself as kidney stones. Which, I don't know, I got this thing with kidney stones. But anyway, I said, you know, if you could do that thing you did with me for the kidney stones, man, it'll make her feel better and she'll be fine. And I absolutely love my wife. She's wonderful, beautiful, and the light of my life.
I saw a picture of it. If you bring it out, I'll show it on TV.
Okay. But the bottom line was
beautiful.
That he took a look and he said, well, you know, doesn't seem like kidney stones. Said, looks like a disc problem. She'd been suffering with this for over a year. And coincidentally, a little over a year before, we had gone to her aunt's 75th birthday party. And she was dancing and went down. And
Irina went down or somebody else?
Just she fell over.
Irina did?
Yeah. And come to find out, Dr. Dan was right. It was the disc. One treatment, back. After a year and a half of suffering every day, no more pain.
Don't you, to treat a disc, isn't that a chiropractor?
Well, you can have a bulging disc. It can be also be from a malalignment.
One treatment, she was fixed?
That was it. It's like with my kidney stones. I mean, it's just like, you got to be kidding. But he's osteopath. I don't even remember how you pronounce it.
How do you say the name?
Osteopathic, yeah.
Osteopathic.
She needs osteopathic manipulation. We also do prolotherapy, so if somebody needs help with tightening up the joints, the ligaments and the tendons, there's injections that can be given.
But today she's healthy.
Oh, she's incredible. And, it's one of the things that's amazing to me because every time I go to a doctor, I've got VA, I've got all kinds of stuff. You go to anybody else, and all they want to do is prescribe pills. They don't know who you are. They know nothing about you. You give them your symptoms or whatever, and they give you some kind of pill. Dr. Dan isn't that way. He really cares. He really looks at what the problem is and helps solve the problem.
And he solves problems so they won't ever reoccur or never occur in the first place because he's a wellness type doctor.
Well, yeah, it might come back someday in the future, but like my kidney stones were 15 years ago. I haven't had a problem since then. And I was bleeding every day for a month and a half.
Do you do things with migraine headaches?
Absolutely.
Okay, my brother is constantly has migraine headaches. I mean, it's been a horrible thing his whole life. Have you ever had migraine headaches? I never have.
I don't. I've only got that one neuron, so it doesn't really bother me.
But I ought to bring him down here and have him talk to you because he wakes up with migraine headaches and goes to bed with migraine headaches, and so he just has that problem. And he also has kidney stones.
Well, one of the things we found with headaches in particular is patients can do very well just with IV magnesium to interrupt the pain, make it less frequent, less intense. Sometimes it can be the result of past trauma, so they may need some prolotherapy injections at the back of their head because the ligaments holding their head to their neck have become weak and the muscles try to compensate, and so it's resulting in pain. So we need to look at those issues. Now, if anybody out there listening wants to contact us, they can find me by phone or on the internet at 702-444-LUCK.
702-444-LUCK, L-U-C-K. I mean, how can you beat that? That's an awesome number.
If you're in pain,
Denny came up
change
with that
your
number.
luck. No.
That's right.
We're in Las Vegas and we want people to get lucky, so
And Irina told Denny about it, and Denny told him about it. Is that right?
Okay, fine. Yeah.
Okay,
easy for you, sir.
Okay, now, that's how they find you. How about an address? How do they find you?
Well, we're really...
Or a website.
Yeah, the website is the same, 702-444-LUCK.com.
Oh, wow.
Here in Las Vegas, we're at Pecos and 215, so we're very easy to find. That's Pecos and I-215. Now, I did want to share a couple of stories of some patients I thought the audience might find interesting. One of them was actually from a doctor friend of mine. He had a blockage in his coronary artery for which they had put a stent in. And it was a congenital artery called the intercessory ramus. I'm sure you haven't heard of it. I wasn't familiar with it, but it's one of the coronary arteries. The interesting thing is, after they put the stent in, he still had chest pain. And so I told him, come to Vegas, get lucky, and we would do the stem cell treatment on him. When he came, we did one treatment. We actually combined it with a little electromagnetic field therapy to help direct where we wanted the cells to go. But after that, he had no more pain. So one of the things we found where stem cells can be particularly helpful, we have seen many types of conditions respond, because we initially started treating patients with COPD. And I will say that the one patient that we're still treating, who initially came to me, we started this over 5 years ago with COPD, was in a COPD physical therapy group, and there were 12 of them. 11 are dead, and she's the only one still living. We've
Wow.
also treated many Parkinson's patients, and one of my Parkinson's patients was able to stop shuffling. He was able to start singing and playing the guitar again, which he hadn't done for 4 years prior to that. So we do see a lot of interesting results, but one thing that really responds well is the inflammatory pain issues. I had a patient of mine who's been of mine for many years. She's got rheumatoid arthritis. She's confined to a wheelchair, but she had one joint that was particularly giving her problem in the ankle. And so we decided to go ahead and do the stem cells. We injected the ankle, and that was 2.5 years ago. I haven't seen her since. She's been doing fine. So sometimes it can be as easy as one treatment. Some conditions require more treatments. What the audience needs to understand is stem cells is still in its infancy. We have so much to learn about the maximum or the optimum concentration of cells and how best to deliver them and the number of treatments. But I have seen a number of people, including myself, respond well with even one treatment. A lot of it depends on how complicated the disease, how long they've had it, and so forth.
Wow. Okay. Now, do we want to bring Larry back in here with something interesting? Larry, can you contribute something here where we're at, since you brought this technology to Mr. Dan Royal, Dr. Dan Royal, in the first place?
Well, I'm really familiar with that one COPD patient. Just an extraordinary story of success. She was also a friend of ours to begin with before she knew Dr. Dan, and we had met with her and her husband several times, and she had such a decline of health for, I don't know, the first year or two, and then she got her first stem cell treatment with Dr. Dan. I think that was like back in 2010, was it? 2010. Yes. Unbelievable results on that woman. In fact, she was so excited about it that she wanted to do something unique. Instead of having one treatment every several months or a year, she wanted to go and let's see if we can get a treatment going at least, maybe even once or twice a month. Now that's interesting, because it still is pretty expensive, but multiple stem cell treatments, putting those stem cells in your body that are activated, and that's a big thing we need to talk about here, is activated stem cells. You can increase your stem cells in your bloodstream with what we do, but there appears to be needed a medical procedure to take the stem cells out and activate them, wake them up. Like when they go back into your body, they're on full alert, looking for things that are wrong. And without doing that, if you just increase them in your body, we've known a benefit using the supplements and the pre-product stem cell volume enhancement program, but it is the activation process that happens during the medical procedure that changes things. And the other thing I want to say, this is very important too, is Dr. Dan has figured out a way, it appears, to get past the blood-brain barrier. If you put it in your arteries, if you re-inject in your arteries, it's going to have a difficult time getting into those into your brain, into the blood-brain barrier. But he has developed a patented technology that can make that happen. And so then we started focusing on treating neurological disorders with great, phenomenal success.
That's awesome. Listen, if you want to get involved with a wellness doctor that's beyond anybody I've ever met, and we've shared a lot of unique things here today, and of course we've shared a lot of the unique treatments and unique technologies about it. In closing, anything you want to say?
You can get a hold of us at 702-444-LUCK or
Okay.
702-444-LUCK.com
We'll say it all
here
at
in
the
Las
same
Vegas.
time.
702-444-LUCK.
Okay,
You're
call
in
us.
luck.
Bye-bye.